All right, well, seriously, let's go ahead and get started. Thank you all for joining on this third and final morning of the health conference. I think we're all probably maybe a little bit tired, maybe a little bit more hoarse than how we started the conference initially, but we really appreciate you sticking around for this particular talk. I am Tanya Dillard. I am the head of product management and innovation for CirrusMD.
I'm Zaid Yassin. I'm the healthcare industry lead for Writer, and also a practicing emergency physician. That is my side hustle.
All right, so who is CirrusMD? So we are a chat-first virtual primary care platform. We deliver care across the United States. In all 50 states, we have physicians that are licensed in all 50 states. And we meet our patients in under 60 seconds, not with a chatbot, not with a triage tool. Every time a patient comes onto our platform, they meet a true doctor in less than 60 seconds. In fact, we are at about 15 seconds in time to connect with our patients. We're headquartered in Denver. We've been around for 12 years. Patients love us. We are able to solve their issues in about 83% of the time virtually on the platform without any additional work. If you come once, you're more likely to come back. 47% of the people on our platform are return users. And we're really proud of our 96% satisfaction score from our patients. So our patients love us. Our buyers love us. We have 13 million patients now on our platform, and we have been able to deliver a little over $1 billion of savings across our direct-to-employer clients, as well as our government, and as well as our payer clients. And we recently just published a study with an actuarial firm that was proving our 3-to-1 guaranteed ROI. So that's Cirrus.
And so we're Writer. We're a full stack enterprise generative AI platform, and we are the way to get generative AI into all parts of your company to deliver impact responsibly at scale quickly. We'll have a little bit more about how we do that as we get into the presentation, but I think what's worth knowing is that we've been around since 2020, which is a short time as companies go by generative AI, a long time. So we've had the chance to understand how do you really use this technology and get it into actual impact, which is why 40 of the Fortune 500 companies use us to deliver their generative AI solutions.
Okay, so what brings CirrusMD and Writer together? So to understand that, you have to understand the business problems that CirrusMD is trying to solve. And that really starts with how we think about the point of care. We believe that the point of care is really one of the most impactful points on a journey in healthcare to affect positive outcomes, whether that's clinical outcomes, financial outcomes, or even patient satisfaction. So with that, we think about, all right, how do we make the point of care more effective? It's a really special time where you have a patient who has a need, and that means they are activated, they are open, they are ready to listen, they are motivated to act on the information that a physician gives them. And a physician is really unique in this space. They are the only ones who can do 4 things. They're the only ones who can triage, diagnose, treat, and refer. The only ones who can do all of that. So you have this very unique space in the care journey. But what we find is that there's really critical information that's missing out in that care journey. And so we started to contemplate what kind of great information could we get in at the point of care that is helpful to the physician to have a really effective care plan for those better outcomes. And so as we thought about that type of information that you could get in, whether it's additional benefits information, whether it's additional patient information, how could we do that effectively that's not going to increase the burden of the physician? Physicians are very protective of their workflows, rightfully, so it has to be seamless. So as we started to contemplate that, we started talking to our ML engineer internally and started to see or ask the question, could we use AI to help with this problem of getting good information in? And we were in agreement, yes. AI has great promise for this, so let's start to develop criteria that supports our business and responsibly uses AI. And so here's what we came up with. If we were going to go down this path, it had to bring in quality information that enriches the experience, enriches the encounter. It cannot be noise, it must be signal. It also had to still uphold physician satisfaction. We are all about trying to give a new proposition to physicians who are practicing medicine. So it wasn't going to work if they had more administrative burden. It needed to reduce that, and it needed to do it in a way that they would radically adopt this technology. It also needed to support our speed to contact with our patients. It was never on the table for us to use AI in a way that comes between our patients and our providers. We were never going to use it as a chatbot. We always had to use it with the speed of contact in mind that needed to be under 60 seconds. It also needed to scale with us. We knew that at some point we would have, we would start with non-clinical use cases, but then we would up the ante and start to use more clinical use cases. So it needed to be able to scale across both of those. And then, of course, cost, of course, is always a concern, but it also needed to help us maintain affordability, but without rationing care. And that's often how AI, I think, is employed with a lot of companies, is they're starting to think about, how do I use it as a care rationing mechanism rather than a care enhancement mechanism? So we've got our criteria. We're going to solve these problems. Off into the world we go with our single ML engineer. We are going to build it all. But as we started to experiment, we were working with OpenAI's GPT models, and they were rapidly iterating on their models. We had GPT-3, 3.5, 3.5 Turbo, 4 point, and as they were iterating every time, it was kind of hitting us back to square one with our product development. And so we really were having kind of unpredictable performance, and it was causing us to push our product launches out. We also, again, were kind of concerned that the GPT models were not they're not based on medical information. So they are trained on all of the internet, and that's fine for non-medical use cases. But as we started to contemplate medical use cases, we wanted a generative AI model that could understand medical jargon, medical terminology. And that's not something that the OpenAI models were going to be able to handle probably very well. We weren't super confident about that. And then finally, we have our 1ML model, or our 1ML engineer, who's going to do all of this. Wrong. As we continued to build, we continued to learn, and we continued to realize we were really under-resourced for this endeavor. We needed to add more people, add more infrastructure, and as the scope of this project continued to grow, we had to say, stop, hold on. Are we an AI company, or are we a healthcare delivery company? We're a healthcare delivery company, empowered by technology. It is not our North Star to be an AI company. We want to solve access problems in primary care. And so we stopped the internal build, and we commenced an external search, and that is what brought us to Writer.
So I think what the story that you heard from Tanya about Cirrus's journey is really the natural history for enterprise generative AI. It's a story that we've seen in different variants with almost all of the companies that we work with. Generative AI is obviously transformative. It has incredible potential. Let's start building it themselves until you realize it's hard. Doing this really well with the level of reliability, responsibility, deployability, scale is not easy. And so most companies, large and small, they go through this process and they realize we can't do this ourselves. Building it with engineers takes a really long time. It's really, really expensive. Unless you are a truly AI company, you'll never have the number of engineers and technology that you have in order to do everything the business needs. And I think one of the learnings from generative AI is that there is no one killer app. Every, not just organization, but every function has 5, 10, 20 different things that need to be generative AI enabled, and your internal tech teams will never be able to build them all. And if you want to buy them all from different point solutions, it becomes unscalable and ungovernable. You can't treat it would be like if you treated this environment and this shop floor as a bazaar. I'm going to get my carrots here, some onions here, some ground beef over there, and put it all together. That doesn't work for the way you need to get generative AI. And so the way we solve this is, if you could get to the next slide, by having a unique full stack approach. We have all the pieces that are built to work together, functioning like building with Legos, not sculpting raw metal, which means that we can do this together in a fraction of the time of doing it yourself or working with an agency, an engineering type of model where everything has to be built and manually connected. We have a proprietary set of large language models trained on curated data, including Palmyra Med, we'll talk more about that in a moment, as well as Knowledge Graph, our way of bringing in through RAG the proprietary information that exists in every company, and which is a fundamental component to having applications that really work for your use case and your company. And the guardrails to keep it safe, a way of building through our AI Studio and integrations so that the build-in connection goes really fast with the kind of customization that you'd otherwise need engineers for. And because we're doing it for so many companies, and we've seen this show go on so many times, we deliver AI program and change management so that you can learn from the best practices in the industry, and we really walk you through the process. And a little bit more about Palmyra Med. To what Tanya was saying before, medicine is its own language. Our models all speak 33 different languages, but some of them also speak medicine, which really is its own language. And having a very high performant model has been important for medical applications. And Palmyra Med is, by a substantial margin, the highest performing medical specific large language model that is available to anyone today.
Yeah, this, when we were really looking through the vendors, this really is one of the differentiators for us, that we would be able to scale with a large language model that really did understand the language of medicine. Okay, so let's talk about the use cases. So pulling in good information into the point of care. So the first one was benefits navigation at the point of care. So our hypothesis is that if a provider recommends a third-party resource, so I'll talk about what that means in a moment, a patient is much more likely to use it because it is recommended by their physician and it is in their care plan. Now, these third-party resources, most physicians don't know that they exist. Many of these third-party resources are bought directly by employers. Many of these companies are actually exhibiting here today, the Sword Healths, the Omadas of the world. But physicians have no idea that they exist and that they're available to a patient, and they may actually work really well inside the care plan that has already been defined. And so we thought, can we bring that into the physician workflow so that the physician could, if you would consider, prescribe it as something that's part of their care plan. And so we took that on. We had built this or started down this path, building it manually first, and then we kind of had to stop the build, and we started working with Writer on this. So if you can think of it this way, we constructed it in such a way where the AI intelligence reads what's in the chat and can understand exactly what the chat is about. For example, somebody shows up with a behavioral health need. We screen them, perhaps they're appropriate for a SSRI prescription. So the chat says, oh, this is a behavioral health, or the AI says, this is a behavioral health chat, great. I'm now gonna go out and find any relevant benefits and bring them, return them back to the doctor into their workflow in our EMR. The doctor clicks on the button, says, oh, this person also has therapy, free therapy available through, let's say, Spring Health, available through Spring Health that also might be something that they would be interested in, not just taking the medication. I'm gonna give this to them in their care plan. We were really pleased with the results of this. And so over our manual, because we were doing this manually first, compared to the manual usage, our providers were using it 400% more. That means they were looking at it. They were recommending it to patients 234% more. There's a lot of reasons there's a delta between the two that are clinical in nature. It's not always appropriate to refer sometimes to these third-party benefits. We give our providers the ability to make that decision. Again, we're not going to put AI in front of our patients. It is really a tool for our providers. They then make the determination of whether or not they're going to share this. The cool thing about this is it validated our hypothesis. Yes, if a provider made the recommendation to use that particular benefit and put it in the care plan, we actually saw a 30% increase in the patients engaging in those resources. So we were thrilled with that. Additionally, we were able to get this use case off the ground in less than 4 months. It was actually closer to about 2 months. So we were really thrilled with the results there. Second use case. So this is where, we start to say, great, we're now going to put more information into the point of care for providers. How do we start to reduce provider burden? And so we started to think through how could we start taking the documentation burden off of our providers. Our providers, like all providers, are really interested in patient care. When it gets busy on the platform, you might imagine that our providers kind of defer the documentation. We also know that's not great practice. So how could we, in the moment, again, survey the chat, we understand, or the AI understands that this is a musculoskeletal chat, summarize the chat, return a summary to the physician. They can then say, yes, this is correct, or edit it if need be, and then move on with their day. Their documentation is done. What you see in front of you is actually a screenshot of our app and the back and forth between a patient. And to the right, you see just kind of the summarized SOAP note, if you will, that would be presented to the provider to approve or edit. We're excited about this. This is being in test right now. We predict that this is going to be about a 20% time saver for documentation for our providers. So they are very excited for us to get automated progress notes off the ground, because then they can see more patients, which is what they love to do. So I think it's important to kind of take a step back and contrast kind of the internal build. So we had 12 months, at which point we still didn't have a viable product. Compare that to the 6 months in which not only were we able to get our first use case off the ground, but we're in testing for our second use case. So we've been really pleased with the progress that we've been made with Writer. I would say if there's a few things that I would want to leave you with at the end of this talk is generative AI has incredible potential. We see it everywhere, but I would say be pragmatic and start with concrete value use cases first. Also start with lower risk use cases first, non-clinical, and then step into the a little bit higher risk use cases with the clinical side of it. And then if there's nothing you can remember from what I said today, it should be at least this one thing. Doing it on your own is hard and it is slow. If it is not your North Star, as it was not ours, go and invest in the expertise of those companies who do this. We were super happy with the decision that we made, and it has allowed us to now really focus on what we do, which is great care.
Thank you, Tanya. And I think I want to echo that. We think that generative AI, everyone should be using it. Almost no one should be building it themselves unless that is really what you do day in and day out, because it requires a certain technical basis that you can't do as a side project or at a skunkworks inside a company whose real strength is somewhere else. I love what Tanya said at the end about how do you get started, areas where you can drive value, but where the risk profile is low. So if you look at where we got started together, we started with benefits navigation. It allowed us to learn about how do you use non-deterministic algorithms with data from multiple sources and get that useful into the physician's workflow at the point of care, but in an area where if there are hiccups, you can't hurt anybody, you can't break the law, nothing really bad can happen if it doesn't go well as you're learning how to use it. From there, we moved on to clinical documentation, understanding what is clinical language like? How is it processed in Cirrus's context? So now we understand non-deterministic algorithms, we understand point of care decision and support, we understand clinical language, and now we're in the process of talking about what are the next steps? How do we step up the value chain, go to things that have more complexity, more potential for impact that we wouldn't have wanted to start at, but now we're getting ready. So talking about areas like quality review. No one likes doing chart review. It is tedious, it takes a long time, you can never do more than a fraction of the cases, and it requires your medical directors, the scarcest group of people within the company. With AI, we can review every single chart and then only flag for review by the medical directors areas where you really do need that human interaction to have much deeper understanding of what's going on clinically. And then once we've understood quality from that point of view, figuring out how do we improve that quality with clinical decision support at the point of care, which integrates the learnings from all those 3 earlier steps, but where we wouldn't have wanted to get started. So thank you so much for staying around. If you're still here at Health on Wednesday morning, we know you stayed just for this session, so thank you. And if you have any questions, we'd love to talk to you some more.